Hello world, how you doing? My name's Dr. Shaham Das. I'm a consultant forensic psychiatrist. I work in London and I treat and assess a whole range of mental health issues. Welcome to Time for a Quick Shrink. Today I'm going to talk about complex PTSD. The reason being is because I recently interviewed somebody for my podcast named Ariel, and she disclosed that she had this diagnosis, and then shortly afterwards somebody actually reached out on Twitter and asked me to describe it. So that's what I'm going to do here for you. So you might already be familiar with post-traumatic stress disorder, and as you probably know, it's a condition that affects people after serious trauma. So that can be anything from witnessing war or atrocities to being physically or sexually abused or surviving a really bad car accident or a natural disaster. Another guest on my podcast, John Clarke, developed PTSD from his years on the police force after he saw a young boy being stabbed and dying in his arms. So complex PTSD is different in that the trauma tends to be more severe. It tends to be prolonged or repeated over a long period of time, and generally it tends to happen in childhood. So I'm talking most obviously about cases of like sexual or physical abuse. On the surface, complex PTSD might seem just like ordinary post-traumatic stress disorder because it has the same symptoms. So they are reliving the experience in the form of like flashbacks or nightmares or emotional numbing or avoiding triggers that remind the sufferer of the experience, and also hypervigilance, which is like a constant state of anxiety. But complex PTSD on top of all those has additional symptoms or features, which I'll get to in a minute. So as I said, complex PTSD develops because it's repeated traumas over years or months. So typically, as well as sexual and physical abuse, it could be somebody growing up in like a war zone, so they see lots of people dying regularly. Could be related to domestic violence, could be related to being held captive. I think in my career, two cases that I distinctly remember of complex PTSD. One involved a young boy who was repeatedly sexually abused over his childhood, and another was a victim of human trafficking. So when an adult experiences a traumatic event, they have the tools to understand and process what is happening to them to a degree, whereas children don't possess these skills. And another complicating factor is that often the perpetrator is actually supposed to be the caregiver. So this means that the child gets very mixed messages from their caregiver, and that forms disorganized attachments. So in terms of the specific features, there is emotional dysregulation, which means a struggle to understand or to contain emotions over your life. So that could be like persistent sadness, increasing suicide attempts, or it can be like this explosive kind of anger that sometimes comes out, and sometimes it comes out disproportionate to the situation in front of you, but it's actually a reflection on what the victim was feeling back then when the trauma happened. Or there's also emotional numbness, so that's just not feeling anything at all for many years. Another feature is difficulty with self-perception. So the sufferer might feel shameful, and they might feel guilty as if they are bad, or they might feel fundamentally helpless as if they can never get better, which is not actually the case. Another big feature is disassociation. So that's kind of floating away from the moment, and it can be anything from harmless daydreaming to like really losing time over a long period of time. This is like a disconnection. So two common types are derealization, which is not believing anything around you is real, and depersonalization, which is the feeling that you yourself are not real. Those processes are associated with dissociative identity disorder, which is split personalities. That's a whole other episode. And often entire episodes of time can go missing. So either a few minutes at a time, or months, or even years, or even whole childhoods can go missing from your memory if the trauma occurred across them and if it was really traumatic. Another consequence is difficulty with relationships, so forming relationships with other people when you're older. The good news is there is treatment, and this is usually in the form of very specific trauma-focused therapy. So there are specialists that only deal in this kind of therapy, and they don't just talk about the trauma, they also talk about the emotions related and how to process and live with those emotions. So if any of this rings true to you or seems familiar to you or a loved one, then I think it'd be a good idea to get more information. Mind, the charity, has a lot of information on its website, so go check that out first. The links will be below. Another sensible idea, I think, would be to go and see your general practitioner, so they might be the first step in referring you on to some specialist therapy. And that's all I have to say on the topic. I hope that was informative. If you have any other questions about yours or a friend's mental health issues, or just in general that you'd like me to discuss, I'd be happy to help. Please feel free to get in touch. Until next time, stay 𝐏𝐬𝐲𝐜𝐡. Bye.